And hello, everyone. Welcome to today's webisode. My name is Andrew Yuhas, a health services specialist here at Geisinger. And joining me today is Tori Miller, manager of telehealth services here at Geisinger. And as we know, healthcare has changed significantly over the past few years. And one of the biggest shifts that we've seen is the growing availability of virtual care. And for many people, virtual care offers a much more convenient way to connect with their healthcare providers, whether that means scheduling the appointment from the comfort of their home, speaking with a provider while they're traveling, or accessing care outside of those traditional office hours. So today we're going to talk about what virtual care exactly is, how it works, and the types of services that may be available to you. We're also going to discuss who can benefit from virtual care, when it might be appropriate, and how we can help individuals and families better manage their health anytime, anywhere through virtual care. And our goal today is really to help our viewers to feel more informed, to feel more comfortable, and of course, to be more confident when they're considering virtual care as part of their healthcare experience. So before we begin, I just want to share our general disclaimer. This information is being provided in order to increase your awareness. It is not intended to be used as medical advice. And if you believe that you have any medical conditions or specific questions regarding your health, please speak with your physician. And I want to welcome you today, Tori. Thank you so much for joining us. Really appreciate you being here.
Yeah, absolutely. Thank you so much for having me today.
Yeah, of course. So to start us out, I'd like to just set the foundation for today's conversation. And with that being said, when we hear the term virtual care, as I've already mentioned a few times, we hear it so often, but many of us might not fully understand what it means or what the different types of services can include. So when we say virtual care, what are the different types of care that people may be referring to?
Yeah, when we talk about virtual care, I mean, we're really talking about any healthcare delivered remotely through technology. Most people will think of video visits right up front, and that's certainly a big part of it. For example, we have our virtual urgent care, which allows patients to connect to a provider by video for, common things, colds, flu, sinus infection, things along those lines. But virtual care can expand beyond that. It goes into the scheduled video visits with your primary care provider or even with specialists. Behavioral health is a big proponent of virtual care as well. But virtual care goes beyond the video visit. It can include things like secure messaging within your patient portal. There's e-visits. E-visits is where a patient can complete an online questionnaire, send it in and have their symptoms and issues evaluated. And then there's also things like remote patient monitoring, things like blood pressures, blood glucose, weight, oxygen levels. Those all can be monitored from home. So organizations like Geisinger, they also have some advanced models like hospital at home, where patients can receive hospital level care supported by virtual technology for in-home services. So really the simplest way to think about virtual care is that it's an umbrella term for the many ways that healthcare can be delivered remotely, that help patients connect and access care when and where they need it.
Yeah, I think that's a super helpful overview, and it's really just a great starting out point for understanding how broad this term for virtual care could be. It's important to realize that it's, like you said, an umbrella. It's a variety of different services and offerings just throughout, healthcare. And virtual care, as we know, can really help to reduce some common barriers to healthcare. So what would some of the greatest benefits that virtual care is going to offer for both individuals as well as families, particularly in terms of things like convenience that we know, things like improved access, and even support for those that might have mobility challenges, challenges around transportation, things like that?
Yeah, I mean, one of the greatest benefits of virtual care is that it makes healthcare more convenient and accessible for patients and family members. Instead of taking time off of work and, think about arranging childcare or traveling long distances, many patients can connect with a provider from home, from work, or, wherever they happen to be at. There are places we don't recommend. Sometimes inside of a moving car is not your most ideal spot to connect. So, be a little mindful there, but really it's wherever you are, we can reach you. So, virtual care is there to improve access to care, especially for individuals
Mhm.
that live in rural areas, underserved areas where specialists may not be readily available. So it helps patients get, the right care more quickly and can reduce delays that might occur when in-person appointments just, are difficult to get scheduled. For individuals that have mobility challenges, chronic conditions, disabilities, different barriers, virtual care can be particularly impactful there. It just reduces the physical burden of having to travel to appointments, which allows, patients to receive care, from the comfort of their home and just be convenient. So, and then beyond convenience, it's really there to it's really virtual care helps patients stay more engaged. So engagement is a big thing. Sometimes it's a good amount of time between your appointments, maybe with the provider, and questions come up. So it helps you stay connected. So ultimately, it's, about meeting patients where they are and making it easier for them to, access timely, high quality care.
Yeah, those are definitely great points. Meeting patients where they are, super important. And I think the convenience of virtual care just makes it much easier for people to stay connected with their healthcare. For example, things that I've heard, employees are able to schedule their virtual primary care appointments during their lunch break, maybe another break during their workday, allowing them to have the convenience to get the care where they are without needing to travel to either the provider's office or spending an additional amount of time away from work, which we recognize is a challenge for so many folks. And then one additional question that, comes up quite a bit is knowing when virtual care is appropriate versus when it's better to be seen in person. So what would you say the health concerns that can be commonly addressed through virtual care are, even including services like telenurse, MyChart messaging, and when is that in-person visit going to still be that best option for folks?
Yeah, I mean, many common health concerns can be addressed through virtual care. Video visits are often appropriate for, like I already said, the colds and flus type symptoms. But medication follow-up, chronic disease management, behavioral health services, all can be utilized with, through virtual care. Patients can, utilize services like telenurse to get guidance on symptoms. Really, what would they could call into the nurse and be directed to what is the correct line of care to go and receive, based on what they're experiencing. MyChart messaging is another valuable virtual tool. It's often used for non-urgent questions. There's automated medication refill requests that can be done, follow-up questions with your care team, and just getting clarification on treatment plans. So that's where MyChart messaging would come into play with your care team. So while virtual care can address a wide range of needs, there are still situations where, of course, where in-person is the best option. Patients should be seen in person when physical exam is required, diagnostic testing, imaging, any type of hands-on treatment is needed. That's where, the in-person is. And then, of course, there's serious things that come up: chest pain, difficulty breathing, signs of stroke, severe injuries. Virtual care, should not be an option there. You should go and seek your immediate emergency care services in person then. So the key is really, matching patients' needs to the right care setting. Virtual care provides convenient access for routine and non-emergency concerns, but the in-person care remains essential when a more comprehensive evaluation or treatment is required.
Yeah, I think that distinction is super important, matching the patient's needs to the right care setting. We just need to be mindful because understanding when virtual care is the appropriate choice, it's going to lead to the right type of care, the most efficient care that person's going to be receiving in the moment. It's also important, as you mentioned, to emphasize that these virtual services should never be replacing emergency care during that medical emergency. We always want to utilize the right type of care, the emergency department in those situations. And despite some of the benefits that you've talked about so far, some people may still feel a bit hesitant about virtual care simply because they are not very comfortable with technology, and that's completely understandable. But what reassurance, maybe support, or even some practical preparation tips would you be able to offer that would help somebody feel more comfortable and builds that confidence when it comes to using the technology around virtual care to make sure that the appointments are going smoothly?
Yeah, for anyone who feels hesitant about using virtual care, I'd start by reassuring that the technology is designed to be simple and user-friendly, and there's resources available to help if they run into issues. Many patients find that after their first virtual visit, they're surprised how easy and convenient the experience is. I mean, we speak with our loved ones through different types of platforms, so it's really along the lines of that. To make sure a visit goes smoothly, there's a few simple steps patients, can do ahead of time. Test their device, make sure their camera, and microphone, and internet connection are all stable. Log in a few minutes early is usually advised. Try to be in a well-lit, quiet, location so you can feel comfortable speaking with your provider. And it's also important, to prepare for your time with your provider. Have your list of medications there. Have your questions. You can write those down and have them ready. Be ready to discuss your symptoms. No different than that in-person appointment. And just to kind of go back on the fact of the internet connection. Being in the rural areas, sometimes I find that your cell phone connections, I think we've all experienced some lag in cell phone connection in our rural areas. So
Mhm.
that's why I do, usually suggest that you're logged into a secure internet connection versus always relying on cellular network just to make sure you do have that smooth connection. So, those are some helpful tips. But, patients should know that virtual visits are also conducted with the same focus on privacy and safety and quality of care as in-person appointments. Providers can evaluate your health concerns and answer and treat your questions. But ultimately, virtual care is just another way to connect with your healthcare team. And the goal is to make, receiving your care convenient and accessible, but still maintain your support and partnership with your provider.
Yeah, I think that's super reassuring as well as practical. And it's helpful for me as well as a lot of the viewers just to simply know that we don't need to be technology experts by any means. And to your point, it's a lot of technology that hopefully we're using in our day to days, speaking with our friends, loved ones, and family. And just being able to have those, a few simple preparation tips, I think is really going to help set that foundation to make us feel more confident for that next virtual visits that we plan on having. But shifting gears, another topic that I wanted to discuss is another area where virtual care has made a significant impact is supporting of ongoing health management rather than just treating immediate concerns. So, could you speak a little bit about how virtual care supports individuals managing chronic long-term conditions such as diabetes, hypertension, asthma, or any other long-term conditions that you'd like to speak about?
Yeah, virtual care can be a powerful tool for, managing those chronic conditions, like you said. It just helps you stay connected with your care team between those in-person appointments. So those patients with diabetes, asthma, heart disease, other long-term concerns, regular follow-up is always important, and virtual care can just reduce that barrier to getting that ongoing support. So, through virtual visits, providers can review those symptoms, discuss your medications, reviews, seeing how they're working for you, answer those questions, make the adjustments as necessary, and just help patients, stay on track with their health goals. Many
Mhm.
organizations, such as Geisinger, we, offer remote patient monitoring where patients can share readings from devices like, again, the blood pressure cuffs, glucometers, scales, and that just, helps care teams, monitor the trends of the patient at home, and then certainly intervene when concerns arise. Virtual care can, it can also be especially helpful for patients who have difficulty with the traveling, as we spoke about before. So, have those mobility challenges there, and you're managing those conditions and transportation and work issues and caregiving responsibilities come up. Instead of waiting for that in-person appointment, and the problem could get worse, you can use that virtual care to check in and address your concerns sooner with your care team. So it's there to support ongoing disease management by making things more accessible and convenient and proactive. I think proactive is very, don't wait for your appointment if something is going wrong. Utilize those virtual services. It's really there to complement in-person care and again helps patients stay engaged in managing their long-term health.
Yeah, that's a great point. It's there to complement it, of course, but it's a great example of how just virtual care in general is going to be able to allow people to better manage their chronic conditions just simply through check-ins, that remote monitoring, as well as, to your point, just earlier support, not waiting, being proactive about it. I think those are super important things to call out. And it's also important to note that mental as well as emotional well-being are just as important as our physical health. And many people are searching for convenient ways to access that support when they need it. So could you talk a little bit about how virtual care has helped expand access into things like behavioral health as well as mental health services?
Yeah, virtual health for behavioral health services or virtual behavioral health services, it really allows patients to connect, to their different support staff. So therapists, counselors, psychiatrists, they're able to, get to the patients within their home. It's, definitely a growing need across the country, and, not just our region here. This can, make it easier for people to take that first step forward to getting support and trying to stay engaged with ongoing treatment. So virtual care, it's helped improve access in the rural and underserved communities where, behavioral health providers might be limited or too far away from where patients live. So going through virtual visits and the virtual tools makes, also gives the patient a broader access to different specialists across the network. So, you're not just relying on those local resources. It allows you to expand further. Maybe, you can connect a little bit better with a certain behavioral health specialist than others. So, you're not defined locally to just those resources. But in addition, the convenience of virtual appointments can lead to better continuity of care for the patient with that provider. Patients might find it easier to keep appointments, participate regularly in the therapy sessions. The ongoing management of it is definitely important. So keeping those appointments becomes a little bit easier. They can manage their medications a little bit easier with those follow-ups. So that ongoing support's really, really important there through those behavioral health services. It's the accessibility, the convenience. It's really patient-centered. That's, enabling people to receive timely support, which I think is important for things around, anxiety, depression, stress, substance abuse, all those other mental health challenges that people may be facing.
Yeah, and I think that's such an important point to call out too. The privacy, the flexibility of those virtual care offerings is going to make it a lot more manageable and feasible for individuals to take that first step that they need towards support to connect with that broader network of behavioral health professionals, as you mentioned, and just stay engaged throughout. And as we know, as healthcare is becoming increasingly digital, privacy and security are always going to remain forefront in our minds, and they're going to be important considerations for our patients as well. So could you speak just a little bit about what measures are currently in place to help protect patient information and ensure virtual care visits remain secure as well as confidential?
Yeah, I mean, protecting patient privacy and confidentiality is at the top priority of virtual care. So, Geisinger and other healthcare organizations often use secure encrypted platforms, that are designed specifically for healthcare and comply with privacy and security regulations to make sure that patient information, stays safe and secure. Um, in addition to secure technology, organizations like Geisinger have, things in place around user authentication, secure patient portals, access controls, and the ongoing monitoring just to make sure, everything is compliant. Again, for the safety for those patients and their health information. Just recently, at Geisinger, we have put our telehealth visits into the patient portal, upping the security there. Not just upping the security by doing that, but putting patients right next to some of the other tools that we spoke about for virtual health, for contacting your providers, e-visits, and so forth. It's all right there. So that's definitely what organizations like we are doing. But the role doesn't just stop with the healthcare facility. Patients play an important role in maintaining privacy.
Mm-hmm.
We encourage them to join visits from private locations whenever possible. Use that secure internet connection that I touched on before. keep their login credentials confidential, and then ensure that their devices are always updated and protected. So it's important for patients to know that virtual visits are, also held in the same standards of privacy and confidentiality as in-person healthcare encounters. So providers conduct virtual appointments in secure environments as well. They document within the medical record. They follow the same professional and ethical responsibilities that they would, during an office visit. So, virtual care is designed to provide convenient access to care, but we're very aware and want to make sure that privacy and security and the trust that patients have, is there from their healthcare team.
Yeah, I think that's helpful for our patients and our members to know how similar the in-person as well as the virtual visits are going to be when it comes to privacy, security. Knowing that here at Geisinger we use secure platforms, there are safeguards in place, but just a nice gentle reminder that we as patients, we need to make sure that we're taking those simple precautions as well, using the private locations, secure internet connection, hopefully a home Wi-Fi, not a shared internet connection, things like that. I think that's going to help folks feel a whole lot more confident that their information is going to be protected. And even with the growing use of virtual care, some people may still have questions and concerns about how it compares with that in-person visit, especially when it comes to the quality of care that we may be receiving. So could you speak a little bit about some of those common misconceptions that you've heard about virtual care visits? For example, as I mentioned, can I expect the same quality of care as if I was in person?
Yeah, I mean, that is a common misconception that people are going to receive a lower quality experience than they would with an in-person visit. But the reality is, it's there for routine non-emergency healthcare needs. Virtual care can provide that same high quality clinical assessment, the guidance and the treatment that patients would receive in a traditional office, setting. Providers they're there to listen to you, they're there to assess you, and that ongoing relationship is there to continue. Sometimes there's other misconceptions that really it's only there for minor illnesses, and I think we've already touched on how chronic disease management and behavioral health support is there and is a great tool. And then there's even the misconception that I hear is, well, virtual care is there for younger patients or the younger populations, but we have countless stories of older adult populations who love using virtual care. The convenience is there, and again, it's not difficult, as we discussed. It's simple technology. It's really there for anybody. Some people worry that providers can't build maybe meaningful relationships with patients virtually, but in practice, we find that many patients find they have very personal, productive conversations with their care team through video visits, especially for ongoing care and those behavioral health services. So, I think those are things that people just need to understand, is that connection can be made. And then just, the complicity, we already touched on, is the technology too intimidating for me? But again, most platforms are designed to be user friendly. Many patients find, again, after that first visit, this is a convenience for me. So, with that said, virtual care, it isn't intended to replace all in-person care. There are times where, physical exam, diagnostic testing and such, and those hands-on treatment are necessary, but the goal isn't virtual versus in-person. As I said before, it's about making sure patients get the right care at the right time and in the right setting.
Yeah, I think that's a helpful clarification as well. Simply knowing what virtual care can as well as cannot do, in the sense of providing for services, it's going to help people feel more confident in choosing the setting that is going to best fit their individual needs at that time. And then as technology continues to evolve and healthcare delivery continues to change, there's a lot of excitement for, what is going to be ahead in the future. So how do you see virtual care continuing to improve that patient experience going forward?
Yeah, looking ahead, I think virtual care, of course, will continue to make healthcare more connected and convenient. And probably the big thing is a little bit more personalized for patients. We're already seeing virtual care evolve beyond the individual video visit into these more integrated experiences that help patients stay connected with their care team throughout the healthcare journey. The other big thing is we're seeing the role of artificial intelligence enhance virtual care experiences. So AI is, can be a scary thing, but it's there to help patients navigate healthcare systems. Healthcare systems can be complex, but it's offering a lot of support, maybe for some symptom assessments. On your Geisinger.org pages, we have symptom checking ability out there. Patients can enter in their symptoms and the things that they are experiencing and go through, and come out with some kind of recommendation. So, and when we're talking about symptom checking and using AI there, it's not meant to replace it's or really to give the diagnosis. It's really to say, here's the right line of care that you should be going to. So never substitute what AI is going to tell you in place of a clinician, but it's really there to help direct and navigate patients throughout the complexities of a healthcare. So as AI and digital tools continue to evolve, they may also identify patients who could benefit more from additional outreach, support more personalized care plans, and provide insights that help care teams intervene earlier, when those healthcare concerns arise. And like I said, it's the key there is, don't think it's going to replace a clinician. It's not going to replace clinicians. It's there to to aid in the journey. And I think that's really where the next steps of some of these technologies will go. So the goal is just to create a better healthcare experience that is more patient-centered and allow individuals to get that right care at the right time.
Yeah, it's definitely exciting to think about, especially if the virtual care is going to become more connected and personalized, as you mentioned. But definitely most important that you mentioned there is that the future isn't about replacing in-person care. There's absolutely no replacement for that. But to your point, it's just about giving our patients more choices, more options, and of course, more flexibility, things that they can pair with their already existing healthcare services. And as we wrap up, I recognize we're coming towards the end of our webisode. I always like to leave our viewers with just one simple practical takeaway from the session. So if there's one key message, one key action step that you hope all the viewers that are listening in today about our conversation regarding virtual care, what would you like to share with them?
Yeah, I think if there's one thing I want people to take away from the conversation today, it's don't fear virtual care. Don't be afraid of it. It's really a summary of a lot of the things we've talked about. For some people, using technology for healthcare can feel unfamiliar or intimidating at first, and that's completely understandable. But virtual care isn't meant to replace personal connections between patients and their healthcare team. It's simply another way to access that same care. Think of it as an extension of patient care experience. Sometimes the best option is an in-person visit. Sometimes it's a video visit. Sometimes it's a call to the telenurse. Could be a MyChart message, where things that can meet your needs more quickly and conveniently. The goal is always the same: help patients get to the right care at the right time in the right setting. So many patients who've never used virtual care, like I said, they're pleasantly surprised how simple and comfortable it is. Once they experience it, they often see it just another tool that helps them stay connected to their provider and engage in their health. So as healthcare continues to evolve, virtual care is going to become a normal and trusted part of the process of how care is delivered. So my encouragement to everyone is keep an open mind, explore the options available to you, and the virtual care is there to make accessing care easier. It's not supposed to make it more complicated, and at the end of the day, it's not about the technology. It's about getting the care and the support that everyone needs.
That's a great takeaway. I think it's a very helpful way to wrap up our conversation today and to summarize that. Just remembering we need to keep an open mind, explore these virtual care options that are available. And they're going to help us find, convenient ways to stay connected to our healthcare teams, receive that right care in the setting that's going to best fit our needs, of course. But again, I want to thank you, Tori, for joining us today. I'd also like to thank everybody for joining and listening in on how we can better understand virtual care, support individuals and families wherever they are. We recognize that virtual care continues to create new opportunities to connect us with healthcare providers, improve access to care, as well as making our health more convenient. So again, Tori, I really appreciate you taking the time, appreciate your insights and sharing those with us. And I'd like to thank everyone again for tuning in. If you have any questions, comments, concerns, feedback, please feel free to utilize that Q&A feature and we'll get you those answers soon as possible, or you could always feel free to send those to wellness@geisinger.edu. And make sure that you join us next month when we are discussing navigating pregnancy and postpartum. This webisode will be held on September 23rd at 12 o'clock. We hope to see you there. Again, my name is Andrew Yuhas, joined today by Tori Miller. Thank you, everybody, so much, and I hope you all have a great rest of the day.